All right. Hi. Welcome to the HIMSS webinar on IoMT in the COVID world, enabling better care delivery in the new normal. So this is the topic for the day. My name is Farooq Mullah, and I lead the cloud practice at CTS Tech. A little bit about myself. I have over 18 years of experience in the software development industry across Microsoft technologies and open source technologies. uh, have been fortunate to have worked on multiple business domains such as healthcare, finance, and manufacturing. And I hold a bachelor's of degree in computer science from Mumbai University. I'll just kind of quickly kind of talk about my company as well, which is CTS Tech. CTS Tech is a specialist provider of healthcare technology solutions and services. We cater to multiple healthcare organizations and technology companies worldwide. We have been dedicatedly working in the healthcare space for over 15 years now, and we're very proud to have achieved a unicorn status last year. We are a Microsoft partner, and thanks to that, today I have with me Luis Marciari. He's a senior product manager from Microsoft Azure IoT. He'll be joining us for this discussion today. Luis, would you like to quickly introduce yourself?
Yeah, hi, good morning. Great to be with you today. So my name is Luis Macieri. I'm a product manager at Microsoft, and I work on the IoT team. More specifically, I work within the IoT Central team, which is a SaaS offer that helps simplify some of the IoT build out, and we'll talk more about that later. Aside from working on the team specifically, I also look after the healthcare vertical for IoT. So looking specifically where IoT and healthcare can provide value to our customers.
Fantastic. Thanks, Louis. Thanks for taking your time out and joining us on this discussion.
Great
So
to be with
let's
you.
jump. Yeah. So let's jump into what IoT is about. And so, as we all know, Internet of Medical Things, or IoMT in short, has been around for a while. So it's nothing new, and it has been helping improve the patient care for quite some time. But thanks to COVID, I think the adoption of IoMT has accelerated quite a bit in the last few months, and we see that it will actually increase further as we go ahead. So even by even for those who have been sitting on the fence, have started adopting IoMT for a lot of their own improvements in patient care. So today, Luis and I will actually spend time and attempt to throw some light on this rapidly growing space in healthcare. The discussion will be broadly cover the impact of COVID on the healthcare industry and how IoMT is helping improve patient care across the industry verticals. Especially, we'll talk about how Azure IoT is enabling this journey for both providers as well as the medtech companies. Okay. So with that, I'll move on to the main point here. So as we all know, COVID has struck. Today is 27th of May 2020, and the world as we knew has been wrecked by the novel coronavirus. As you speak, the numbers worldwide are close to 6 million confirmed cases and around 350,000 confirmed deaths, with USA having almost 1.7 million confirmed cases and 100,000 confirmed deaths as well. Now, to get this in context, what this basically means is that we have more patients than we have had in the last many decades. And if you look at the ratio of physicians to patients, we have almost 3 physicians per 1,000 patients. Now, in a normal time, this would not have been a big. Now, thanks to COVID, this will become a challenge going forward. So this sets the context, and I would like to kind of talk about now how this will actually impact uh, our industry, our healthcare industry specifically. Now, as we know that the healthcare industry has basically four verticals: the provider, the payer, the medtech, and the life sciences. As we know, industry worldwide has been impacted completely. A lot of industries have been thrown completely out of gear. Travel industry, the hospitality industry. With our healthcare industry, that has of course been impacted by the virus quite a lot. Both in so because of which we have to revamp the way we are actually looking at our solutions. So what we'll talk about right now is kind of briefly cover the impact COVID has had on the provider, the payer, the medtech, and the life sciences. And we'll also talk about the IoT solutions that we kind of see all of these industries are kind of adopting and increasing for themselves. So with provider now, provider are the perhaps the most impacted uh, by the COVID, uh, simply because they're completely inundated with the constant stream of patients who have both COVID and COVID-like symptoms now, which basically means that their medical staff is continuously stretched out to cater to them. And the second aspect here is that the medical staff to patient ratio has significantly increased in the last few months, which is impacting both the patient care and their operations. Uh, in fact, as you might already know, that one of the biggest impact is that all the elective surgeries have been stopped, and we are primarily catering for COVID and health emergencies only. So, how is the provider industry actually so how does IoT actually helping the provider industry? Now, providers hospitals worldwide have realized that they need to improve the operational efficiencies in various forms, because uh, because of the fact that now the number of patients per physician has increased exponentially. It basically means that they'll have to find different forms of engaging the patient and improving the patient care. So remote healthcare has become a big change that we are seeing, and that will definitely change the way things will work in the coming months, and perhaps change the industry for good. In fact, as you know, FCC themselves have launched a new $200 million project or a program to fund telehealth programs for all the qualifying providers. So they are infusing money into ensuring that patient care is done remotely via the telehealth systems. Uh, so not only we have remote care management, we also have remote patient monitoring and tracking as well. So for patients, especially who have COVID symptoms or who have symptoms where there might be a relapse, because of the chances that you might have a second wave of COVID or patient might relapse into with the same thing, it's important that we have a mechanism where we can track patients remotely. We cannot afford, I mean, especially because of the infection risk which is there, patients are not all the patients are able to kind of come to the hospital and get themselves treated. And in fact, providers themselves are preferring that they can actually handle patients remotely as far as possible to avoid any kind of infection risk. So that is definitely a big plus that we're seeing in terms of IoT. So we're seeing a lot of adoption of smart devices and telehealth services, in fact, for providers going forward. In the case of payer market, which is basically the insurance industry vertical, what the COVID impact has been that we have seen an overall spike in the number of course, in the spike of claims processing numbers, uh, which basically means that the COVID-related claims have increased. But the negative impact of that is that the potential long-term impact on premium payments will also be there because of people not being able to go to the jobs, not being able to perform as they used to do in the past. So that has impacted the pay industry, and that will go on. So what payers are actually looking at now is they have an increased focus on seeing how we can improve preventive care so that patient readmissions are reduced. And so IoT-based remote healthcare is one of the go-to solutions for payers in that market. Coming to medtech industry has seen both a positive and a negative. So the sales in the traditional hospital medical equipment that were used in the past, it could be, for example, operating room equipment, that has reduced because there are no elective surgeries as we speak right now. But at the same time, we have seen a spike in the sale of home care devices, like, for example, thermometers or blood pressure sensors or oxygen measurement units. That has increased, and the same thing has also increased with the smart devices for hospitals. So the medtech industry is also kind of booming in one part of it. It's about who's adapting to the COVID situation at this point. So what is impact is from an IoT perspective, I think the medtech industry will be very highly impacted because now, because providers and patients, they want to have a sort of an ecosystem where they can have a care ecosystem built using these devices. IoT is going to be leveraged across all the devices as we speak, so that providers can give them remote patient support, and you can have the best of the healthcare coming to them in those forms. So uh, now medical devices cannot survive on in silos. Given a choice between given a choice between a medtech device which has IoT enabled, whereas a medtech device which is not, the obvious chances are that even if the medtech device which is slightly expensive but is IoT enabled will be the one that will be sold. Coming to the life sciences is perhaps the most sought after healthcare industry in current times, because uh, they are the ones who will perhaps save the world in terms of cures and vaccines, and also to find ways how immunity can be boosted. So that has impacted the life sciences. What we see over there is there's an increased focus on research in terms of genomics and AI. There's been a big increase over there. Now, how does IoT actually involve life sciences? So what we've seen is that there are a couple of cases where the data acquisition will actually change the way. So earlier you could have cohorts and you could actually have you could actually get data via patients who would actually come to some study centers. But now that's not the case. You'll actually be acquiring data, let's say, remotely. So IoT will be definitely be used over there. At the same time, you'll also need drug manufacturing controlling in terms of temperature, humidity, light, whatnot. So that environment also has to be controlled. So this is nothing new as such. It has been there, but now thanks to COVID, I think there's a bigger focus on this side on these elements. So I'll just kind of move on to the next application part of it. So this is something that Azure IoT kind of provides you out of the box. So we spoke about that IoT has been around, but what we'll see, in fact, something that Louis will actually kind of showcase it to you, is that thanks to IoT, we are seeing new ways of helping the patient outcomes. So it could be in the form of smart hospital building, it could be in the form of smart hospital equipments, it could be in the form of supply tracking, supply chain management, in-home care, and the most important one which has come up is the continuous patient monitoring. Thanks to COVID, now that's going to be one of the biggest buzzwords that we'll keep hearing as we speak. So what are the innovations that we've been seen in the provider space so far? Surprisingly, in the short span of time, we're seeing a lot of new things coming up. So the most obvious things is a concept of the personal emergency response system. So, for example, for anyone who's elderly or who's physically challenged, patients can actually have, if they fall, it can actually be catastrophic. So we have seen fall detection devices being used, which is typically devices which are kind of set up at your waist, and in case there's a fall, it will send out an emergency alert so that the paramedics can actually come in and take care of those patients. Now all of these is especially for senior citizens who are staying alone at home. This actually is one of those things which really helps out. In the case of COVID, one of the things that we've seen is connected thermometer. So, as you know, uh, you need to kind of measure the temperature for all your COVID patients. And if a nurse has to go and check it regularly, that basically means that two things. She has to wear the PPE kit so they ensure that there's no risk for her. And the amount then, and also the same thing is that the efficiency is lost because they have to wear the PPE kit, take it away, and put it back on. So those times are also spent. So what we've seen a few hospitals actually buy IoT-based thermometers, which actually sends automated temperature alerts, and they use something called a Bluetooth. They use BLE for their transmission. So what it basically does is that it actually sends temperatures data over to the nursing station. So the nurses don't actually have to come down to every patient bed to take temperatures. The temperatures are actually sent to the nursing station, and the nursing stations and the nurse at the nursing station can simply look at those temperatures, and if she figures out that some patient has a hike in the temperature, can go and treat the patient at that point. So that saves both time and as well as actually saves the risk of infection for both the patients as well as the staff. The next thing that we've actually seen, which is which is actually sounds pretty straightforward, but has been very useful, is the patient tracker. So whether a person is in a hospital or at home, and whether the patient is a COVID patient or is an Alzheimer's patient, they need to be in a safe zone. They so that that ensures that they are not at risk, and other people are also not at risk. So for example, in case of COVID, there is a concept of quarantining. So you want to ensure that they are staying in that safe zone. Electronic trackers, basically what they do is they'll check your GPS parameters, and if a patient breaches that perimeter, it actually sends out alerts to care providers. So that's something that we'll see quite a bit in the coming months as well. Apart from that, we also have multiple different things. I'll kind of quickly go over these. There are IoT buttons. IoT buttons are basically nothing but a simple devices which are set up either at the patient side, bedside, or even at the nursing station. So what it actually enables us to do is that it helps notify both the medical and the facility staff in case of an emergency that takes place. So, and it's all IoT enabled. It's just simply connects into the Wi-Fi system of the hospital. So you don't have to kind of do any major plumbing. It just kind of goes and kind of attach to anything that's available. Apart from that, the most common things which we have seen in the past is not specific to COVID, is non-invasive continuous glucose monitoring, which is basically for diabetics. Access to the glucose levels is very critical. So this glucose monitors, actually what they do is they provide this information in real time, and they kind of help to optimize the insulin levels for these patients. Uh, and something new that has come in is something called as ingestible sensors and cameras. So what you do is basically you consume a pill which has a camera inside it, and it kind of gives the physicians a real-time visual monitoring so that they can actually diagnose the problem quickly. So in case of colon cancers and multiple other things, this is something that has recently started picking up. And of course, we have the smart patient beds. So smart beds are basically uh, devices which kind of takes all the vitals of the patient. It could be temperature, blood pressure, heart rate, oxygen, and all these are supplied to alerted sent to the medical staff. So in case of there's a system problem that comes in, the nursing staff can actually quickly go and attend to the patient. So that, and again, that all of these are innovations which are useful for improving the patient care. Moving on to, so we spoke about what we see in terms of IoT and what are the benefits of IoT, and I think we have covered in terms of how the patient care is getting better with that. Now let's talk about two aspects about that. What is the key requirement that we're seeing from providers, as well as what are the challenges that we see for them while they are adopting IoT? So the first key requirement for everyone is monitoring patient care remotely. Now, what that basically means is that there are multiple devices that needs aggregating data from. So it could be, for example, you'll have a blood pressure monitor, you may have a glucose monitor, you may have a respiratory system to get your oxygen levels. What happens is you need to kind of aggregate all the data from multiple devices and provide the physician a comprehensive view of the patient's health. So that's one of the requirement as well as a challenge. The second challenge that we've seen, which is very common, is that uh, the heterogeneous device type. So what I mean by that is that IoT devices are not all IoT devices are cloud enabled by default, and that is because they are a different size, they are of different uh, cost of building, and the power consumption of them actually also varies, and that actually has a big factor on how the IoT devices are are connecting with the external system. So some of the devices may have cellular connectivity, some of the devices may not have that. Some of the devices may be able to speak to Wi-Fi or Bluetooth, but some of them may not. So what we're seeing is a different set of heterogeneous device types, which makes adoption of this also a bit difficult for building an ecosystem of data from the devices. Uh, we spoke about the different connectivity options, and that is again a challenge because of the cost and the power usage. What we've seen is that not all the devices are internet ready. So what it basically means is that if a device is not internet ready, how do we get the data from that system? So for devices which are Wi-Fi or cellular enabled, that really works out. But in case of at least devices which have Bluetooth or Bluetooth low energy connectivity, there could be a gateway that can be put up in front of it to get the data from those devices. We'll come to this. We'll actually kind of showcase, talk about this in the upcoming slides. The other challenge that we've seen is the device health monitoring. Now, what I mean by that is that critical devices need to be monitored regularly, and there needs to be a mechanism where, in case the device has a problem or there's a breakdown, a real-time alert needs to go out so that that those issues can be fixed quickly. Now, let's say for example, there's a life support system, and the life support system device actually conks up for some reason or the other. That information has to go out immediately, because if you don't do that, the patient's life is at risk. So we need real-time alerts. Uh, the next aspect is all these devices which are sending data are actually creating a big volume of data. So what we need is how do we process this large amount of data and at the same time ensure that it's secure and the cost of it is also optimized. Because in the long run, the cost will also impact us. Uh, the other challenge that we've seen, especially for providers, is that the medical equipment that they buy it over a period of time, and they are quite expensive. So it's not easy to regularly upgrade them to something new that comes out. So especially for devices which are not internet enabled, it actually leads to outdated hardware and making adoption a bit more difficult. So what we also need is our ways where devices can be made cloud ready or made internet ready in future. So this is what we see mainly in terms of the provider market. Coming to the device manufacturers or the medtech device corporation, this they have a similar set of challenges, but the requirements are slightly different. They too need a device health monitoring system because the devices tend to undergo multiple stress conditions when they are in the real world, and it's very important for device manufacturers to know how they are behaving. So you might have heard about digital twins, which are taken care of to kind of take to ensure that the devices are working, are mimicking what happens in the real world, so that you can actually learn from that and make things better. But that doesn't work for all the devices, because not all devices are going to be expensive, and even for, let's say for example, a device which is cheap, to kind of do that exercise is going to be really, is not going to be worth the ROI. So what you also need is a mechanism where you get this information about the devices in real time, so that in case there's something uh, that you need to take care of in terms of preventive maintenance and upkeep, the device manufacturers can actually go and do it proactively, rather than wait for the system to break down. Uh, and the same challenge which you saw with providers in terms of the heterogeneous device types and the diverse data connectivity options, the same challenge even is plaguing the device manufacturers. Now, device manufacturers, they don't build one device alone. They build multiple different device types, typically in the same area of medicine. It could be in oncology, it could be in radiology, it could be in any other department. So they tend to create multiple different devices, which and typically all the models are sold separately in different markets across the globe. So they need to support multiple different devices as well. It's not that they create one device and they just use the device across every organization. So they'll have that as well. Which basically which brings us to this device tracking aspect. So they have multiple devices out there in the field, which is sprawled across multiple geographics and providers. So they need a mechanism of tracking these devices so that they can help their maintenance and help the sales team as well. Uh, because one of the bread and butter aspects of device manufacturing is not only about selling the devices, but also selling the supplies that goes with the devices. So this actually helps them to identify where the sales needs would be. Uh, Coming to the next few aspects is real-time alerts. We kind of spoke about that earlier, but the same thing applies to device management as well. In case of there's a critical device which has broken down for some reason, they need to ensure that they actually have fixed it quickly. Uh, the other aspect which perhaps medical devices, sorry, the providers don't suffer from, which device management suffer from, is to enforce device upgrades. So for example, you may have devices which are in the field. They may need an upgrade for features, for performance changes, for security, and also for regulatory compliance needs. But once the devices are in the field, changing them is not a trivial matter. So you need a mechanism for upgrading the devices as well. This is one area where actually Azure IoT really shines out. Uh, and then we'll talk about security. Security is so we may imagine that security is a problem only for our computers and our mobile phones, but no, devices are actually are more susceptible to cyber attacks because typically they have more open gaps. They have unpatched software. They may have unauthorized access. They may have non-unique passwords. So those challenges their devices as well. So we need to ensure that that security is taken care of as well. And the last but not the least aspect here is about data analytics. Now, what we mean by data analytics is that if a device is being used in the field, we need to know the pattern of usage. We need to know the who's using it and when it's being used, and the volume of usage for them. So what that helps them to do is they identify how to how long does the device work, B, how to improve the maintenance of the device, and also the sales aspect of it. So and they can actually learn from what challenges people are running into, and they can actually build better devices as they move on. So this was what we have seen with challenges in terms of for IoT in terms of device manufacturers. Now let me come to now we spoke about a lot of this examples in terms of what we do for providers and we spoke about what we do for device manufacturers. Let me take some time and kind of walk you through what a typical IoMT solution looks like. A typical solution is what you see on the screen here is actually starts on the left with the medical devices. Now, medical devices can be of multiple different types. It could be a bedside device. It could be a knee implant. It could be an operation OR powered tools. It could be a wearable device like a Fitbit or a Apple Watch. It could be a no-touch sensor in terms of like, or it could be a blood pressure monitor. It could be heartbeat systems. Multiple things are here. Uh, what happens is all of these are unique in its own type. There's very rarely things are common across these device types. Uh, what is though in a typical solution though, what happens is it's basically made up of 4 stages. So you have the medical devices as the core source of data. The first stage is where you do the device data acquisition. So you may have wearable and you may have OR power tools. You want to get this data uh, you need to acquire the data from those devices. Now, typically this is done via short-range protocols like Bluetooth or Bluetooth low energy or NFC or Wi-Fi. This is especially for devices which are not internet ready. But in case where there are cases where the tools are internet enabled, you can directly use those services. So what you typically have is for devices which are not internet ready, you have a device gateway, which kind of takes care of ensuring that the devices can send data to the device gateway, and the device gateway can be the forwarding mechanism to the cloud or any system that you have in place. Uh, the other critical aspect here is that internet protocols actually also vary. So, for example, there could be COAP. COAP is one of the if you have a constrained environment where you want it could be due to power constraint, it could be due to security. You may have COAP, or you may use REST, or may use MQTT, or you may use AMQP. So there are multiple ways of connecting to the internet. What we have seen typically to be used most commonly is MQTT, but it's not uncommon to see the other protocols as well. At the same time, what we see is that we also have the same layer also takes care of the device firmware upgrade. So we spoke about firmware upgrades earlier. So device data moves from the wearable over to the system, as well as the data moves from and firmware upgrade can go from the manufacturer to the device. So this is where the system actually is a bi-directional system that helps out. Coming to the second stage of the system is where we do device data ingestion. So now that you acquired, so all of these device data acquisition is happening at either at the hospital or at the patient's home. Now we come to the device data ingestion stage where basically device data is acquired from the devices, is sent over to your IoT system. So it could be sent to a cloud IoT gateway. In the case of Azure, it's Azure IoT Central and Azure IoT Hub, where you can send the data over to. And what happens here is once the data is pushed into the system, the data is stored, the data is compressed. You take care of the security, take care of the HIPAA regulatory compliance factors, and you log the data as well. Now, once you ingest the data, the third stage that happens is the moment you get the data into the system, you need to process the system. You need to process the data. Now you get real-time data, and for example, you may have a wearable device which sends information saying that the heart rate has gone beyond the threshold value. You need to send out an alert. So what happens in the case of this device data processing? You actually do real-time data processing, and real-time alerts are sent out. So uh, it's not only about getting the data and pushing them for future, it's also about analyzing the data and ensuring that the real alerts are sent out and action is taken immediately rather than push them out later on. So you can actually take action at this stage. The data that you get is further filtered and transformed and stored into the data lake or the data warehouse. Now, this is where your data analytics comes to play, where once you get the data from the devices, now data can be of two types. It can be the device data or it can be the patient data. So you can actually use the device data for identifying, device data is useful for the device manufacturers. The patient data is useful for the providers. So both the organization can actually can use this data to leverage and identify patterns of what's happening with the patient or the device. Now, what you've seen though is that uh, here once the data comes into the system, you'll have reporting and dashboards to help visualize what's happening to the patient or the device. And you can also have pre-built algorithms or machine learning in place here, which is very specific to your use case, and which will help you to kind of derive further details or further patterns from the data. Now, if you see on the left-hand side, all the devices are actually very unique. So when you build an IoMT solution or an IoT solution, this will always be unique. But what you see in the center here, where's the data acquisition stage, the data ingestion stage, data processing stage, all of these are going to be the same for every device type. So it could be an implant, or it could be a knee implant, or it could be a blood pressure monitor. It will all follow the same concepts here that you see. The only thing that changes perhaps is the kind of reporting that you want to do or the machine learning algorithms that you want to run. Apart from that, everything actually typically stays the same. So we've done multiple IoT applications in the past, and we've kind of when we started off many years back, we didn't realize that we were kind of mimicking the pattern multiple times, and that's where we realized that this middle portion is common. So we'll come to and actually kind of talk to you about what our biggest lesson or takeaway has been so far. But before I get to that, I'll just like to kind of showcase a very simple use case that we've built with Azure IoT. Rather than showcase, I'll just talk about the architecture and we'll do a demo at the end of the system. So this is what we have in terms of uh, so this is a system that was built for patient health monitoring via a wearable device and using Azure IoT as the base on which this was built out. So as you see on the left hand side here, a patient will be sending his health wearable healthcare data using MQTT protocol and send it over to the cloud gateway. So over here, this is the IoT hub which Azure provides. And behind the scenes, what happens is that actually at runtime, there are Azure functions which are running and analyzing the data, and the data is pushed to an event hub. From the event hub is basically a PubSub mechanism where you can actually store all your incoming data fast. I mean, a large volume of data can be handled over there. And what happens at this stage is that the data comes in, the data is enriched, and alerts are sent out in case of any challenges that you see. So a physician or an admin can actually now using their own dashboard, they can actually go and gather data from each of these devices. This data is actually stored into Cosmos DB, and you have an API which actually serves as a mechanism for getting data for the devices. So all the data that you see can be actually stored both in a hot storage, which is your Cosmos DB, and also it's stored in the cold storage, which is in this case it's a blob storage. Now, once the data comes into blob storage, what happens is you can have data scientists run machine learning algorithms on top of the same data. They can, of course, use the hot storage as well. So now what happens is if you look at it, the entire process, it is again in 4 stages. The first is data acquisition. In this case, because the variable is internet enabled, it can simply send it out. The cloud gateway is where the data acquisition is happening, and this is where the data processing is happening at runtime, where you are doing gap analysis, you're doing message enrichment, and sending out alerts at the same time. And then you have the data is stored into SQL database, and you're using data scientists are actually able to use this data and able to build machine learning algorithm on top of that. Azure IoT makes life much more simpler. I mean, just imagine if you had to do all of these things alone on your own. This would have been quite a bit of work. In fact, Louis is going to talk about something that is going to make it even much more simpler for us as we speak. So, what is the key takeaway from all this thing that we've been spoken about so far? If you have to take only one takeaway, we'll say that invest in building an IoT platform so that you can reuse it per device, because majority of the operations that we see in any IoT system for that matter are always going to be the same. So it actually makes sense for business to build a platform and reuse it for the same for the various devices that they have. So for example, today you have a wearable device, tomorrow you may have an oxygen measuring device, or you may have a dialysis device for that matter. They all will actually use the same platform. So it makes sense to build it once and just keep reusing it every time, because that will expedite your time to market. It will reduce the cost of development, and it'll help you drive your business more effectively, because now you can find patterns and usage patterns across those device types. So so with that, what I'll do is I'll just quickly pass it on to Luis, uh, and he'll kind of walk you through how Azure IoT kind of comes and helps you in that journey of IoT. Over to you, Luis.
Awesome. Thanks for that great overview of kind of the challenges that you've seen within IoT in the healthcare space. All of those challenges kind of just match very nicely with the same challenges that we see our customers, not only across healthcare, but also across other industries as well, with connecting, managing, and just running an infrastructure for their IoT devices. So as you mentioned in your previous example, like you talked about that built out of an IoT solution. I was curious to ask you how, how long in general, like, did it take you to build something like that?
Okay, great question actually. So we had two systems. So let me answer this in two ways. About a couple of years back when we built out the first platform, we were building a production ready one, and the first iteration took us at least 3 months to come out, because we were doing multiple things over there. But what we also realize now is that many times seeing is believing. So until business actually sees the value of it, it doesn't, they want to see the value of it first, and that's when we started looking at how can we build quick, easy, and dirty solutions. And the last time around, we built a solution which took us about 2.5 weeks, because we had learned enough around that time. We spent about 2.5 to 3 weeks to build a quick and dirty dashboard to showcase to our client. And once he saw the dashboard, only then actually it stuck him that it actually makes a lot of sense to invest in building something like this. So most of the times I've seen that the initial reluctance is there, but once you showcase the power and the value that they derive out of it, that really helps them. And to showcase that value, it took us at least, if I have to build a showcase, it'll take me 2 to 3 weeks at the minimum aspect of it.
Yeah, yeah. So, well, thanks for that overview about how long how long it's taken you to build something in the past using all the different platform services. That's actually pretty fast, still 2 months to build something from scratch. We see customers take 6+ months to build something as they learn kind of like all the different components they want to use. And it's great to see that you've been able to reduce that from 2 months down to a couple of weeks. But that's still kind of using all the different platform services. And as you mentioned before, there
That's
is
right.
a lot of things kind of in the middle as you kind of just go from devices to the cloud that are kind of just very common. So here's a different view of that similar architecture you shared earlier, where on the left side of the equation, we have all of the different things that you might be able to connect to the cloud, whether they're medical devices, consumer devices, or even just IoT edge devices connecting to the cloud. And then on the right side, on the action space, that's really where the value of IoT kind of comes in and gets unlocked, right? So a lot of what we see there is just the build out of provider dashboards or applications for patients to access their data or their information, or even connectivity with some existing Microsoft infrastructure such as Dynamics 365 and healthcare, Microsoft Teams for healthcare, right? But those things tend to be very unique from solution to solution. But as you alluded to earlier, like that piece in the middle, right? Like what I called here the insights, it's really very common for it to be similar from solution to solution, right? And there's kind of two ways in which you can build this. There is one way which you alluded to earlier, which is you kind of just pick all the different components from Cosmos DB's Azure IoT Hub, time series insight, blob storage, and just kind of stitch all of this thing together yourself. But there's another approach that Microsoft is working on, just simplify that so you can actually spend more time in the left and right sides of the screen. So with Azure IoT Central, like what we're trying to do is just build a managed IoT app platform that reduces the complexity of building that infrastructure and managing it over time, and then allows you to get to the value of IoT faster. So I think you mentioned to me when we talked earlier that you guys have built something on IoT Central.
Yes.
And I'm curious,
Yes.
as you kind of you told me, hey, it took me the first time 2 months, the second time now it takes me 2 to 3 weeks to build something. Can you talk a little bit more about how quickly or not have you been able to build something on top of IoT Central as well?
Yes. So I gave you an example about building a quick and dirty demo for one of our clients using Azure IoT Hub, and that took us about 3 weeks. And when we actually went and made it with the same thing with IoT Central, actually we were surprised to finish that in less than a day. So in fact, it was half a day that we actually finished it off, and it kind of blew our mind, that we could actually just wrap it up in half a day and we could quickly showcase it to the client. That really helped.
That's incredible. That's great. That's kind of the value that we're trying to provide with IoT Central, and we hope that many customers are taking advantage of that. So to that extent, I want to talk a little bit more about Microsoft's portfolio of IoT solutions. Next slide.
Yeah. Just a minute.
So at Microsoft, we've been on a mission to simplify IoT for a while already. That's why 2 years ago, we decided to invest $5 billion over the next 5 years to be able to just continue to make IoT simpler or more easy to access for everyone and every person and every organization on the planet, right? So our stack is the most comprehensive in the industry. So we start all the way down from the edge of the devices. These are the things that are sitting at your location, whether it's a patient's home or a hospital, ranging all the way from the devices. So we have Azure Sphere as a secure microchip. We most recently included Azure IoT, that essentially is a real-time operating system that can run on devices. And we have all the different Azure Data Box and Azure IoT Edge that allows you to just run some of this logic and workloads on premise. Now, if you kind of just decide to just take that data that you've been able to collect to the cloud, then we have all the Azure IoT services and comprehensive as well Azure services that allow you to build your solutions. So ranging from IoT Hub to IoT device provisioning service, all of the AI services that Microsoft provides, as well as all of the storage, DevOps, and Maps capabilities that you've come to know and see within Azure. But taking all of that and just making it even simpler, what we've done with the IoT solution, so as I mentioned earlier, IoT Central as a application platform allows you to just take away some of the complexity of trying to take care of what we call the plumbing and just get into the solution faster, building your kind of business applications on top of the IoT data, which is where the value of IoT is at. We also have reference architectures, which we'll talk about in a second, both for different industries as well as just general IoT architectures for both including IoT Central as well as including the different PaaS components that IoT has. And then we have connectivity with dynamic field services, which is another IoT which is another SaaS platform that allows you to just manage your resources. And across all of this, we're also looking at the different IoT verticals to make sure that the products that we're building kind of meet the use cases that each industry has across the different industries that are out there.
Fantastic.
Next slide. So one of the things that hold on, let me start over there. So one of the things that we've seen with the IoT market is that there is a maturity model that every kind of organization goes through as they kind of progress through their journey, right? Where we see a lot of customers kind of start is in just that connect and monitor phase, which is essentially where all you're doing is just connecting your devices and starting to see that data, right? Like that's kind of your first taste of what IoT is and can do for you. Once people start getting used to that and they get an idea of what they can do or what they can see on the cloud, then they start moving into the analyze and improve phase. And in this phase, now you're taking what you've already reading from IoT data, and you start looking at patterns. You start looking at ways to make your product better, ways to make, in the case of healthcare, your patient's life better, right? And once you kind of master that area, then where we see people move is in transform and expand. And that's really where the peak of the IoT value is realized. And what we see there is essentially just organizations started to think of different ways to monetize their products, or in the case of healthcare, different ways in which you can care for patients, right? So as you mentioned, COVID-19 is accelerating the digital transformation in the healthcare industry, right? So here's an area where we might be able to see that, maybe the way that you start every patient visit is now remote before you actually go to a site, right? So these are the different things that like no one has really thought about that then become a reality. That's where the transform and expand area of IoT is.
Absolutely. So, Luis, if you don't mind me asking you a question here. So typically you have seen industries, you adopt IoT in multiple places. In the healthcare industry, largely where do you see the industry be? Is it in the first phase, the second, or the third?
Yeah, so this is actually very consistent across different industries. We still see a lot of the majority of the time spent is in the connect and monitor still. We're starting to see more and more folks move from connect and monitor to analyze and improve, which is great to see that maturity is happening. And we see very few people in the transform and expand category, but we're hoping that over time, as people get more comfortable with IoT and they see the value, that they start moving into that bucket as well.
Yeah.
Does that kind of match what you're seeing as well on your side with your customers?
We have actually, for us, we've seen more. The large organization that we've seen is starting in the Connect Plus Monitor, but we also have seen organizations which started, let's say, 2 years back or 3 years back. They're in the center stage right now, analyze and improve. Especially with the medtech companies, we're seeing them getting into the transform and expand stage. So the journey has been a bit slow, but what we've seen is people who have started early are actually getting there sooner. So once they start seeing the value of it, I've never seen anyone go back from where they started. So they've never given up. They've actually just added features on top of it. So yeah. So to answer your question, I think I've seen more in the analyze and improve state now. But I would say perhaps 3 or 4 years back, I would have seen more of the people in the connect and monitor area. But for new entries, yes, it's always been the connect plus monitor space. But organizations which are starting, let's say 3 years back, I'm seeing them in the center stage right now.
Yeah,
the journey is different for every company. Yeah.
Right. Yeah.
Should awesome. More to the next one.
Yep. Next slide. So as we alluded to earlier, like again, this is a different way to look at the same data, right? Like where we really see the repetitive nature of IoT is kind of in this middle box, right? So whether it's IoT Hub Maps, web apps, functions, SQL, Cosmos DB storage, managing the resources for identity and all the compute resources and VMs, right? This is one way that you can build your IoT solution. It's just essentially just building all these components and stitching them together. Or another way to build it, it's essentially to use IoT Central. Next slide. So with IoT Central, we essentially take care of all deployment in the middle as your IoT app platform. And essentially, one of the great things about it is that you don't have to worry about just the security aspects of it because we'll take care of the security of all of the different components on the cloud. We provide you with a predictable pricing that makes it easier for you to understand your bill and as well as predict how much your future bill is going to be as you expand your offerings and set of devices. As an enterprise-grade product, we also take care of all the SLAs, and we have SLAs in place that ensure that you will get the services that your organization needs and deserves. And then we also take an industry focus to how we build application templates and the different features within the product to ensure that different industries can take care of this value. Another nice aspect of IoT Central is as we continue to add different features to our portfolio of products in the IoT space, you essentially get them added to the product without having to modify your solution, right? So if you're building something from the ground up and you essentially want to integrate the next big thing into your solution, you need to figure out how to re-architect your solution and how to add it. Whereas with IoT Central as a SaaS product, it will just show up there whenever it's ready for you to consume.
That's cool. That's very cool.
Next slide. So what is IoT Central? And let's get more into the specifics, right? So our goals are pretty simple. Our goals are to get you connected, keeping you connected, and helping you transform your data. So getting you connected is essentially just making it super easy for you to be able to connect your IoT devices to the cloud. So whether it is just all the device modeling capabilities so you can visualize and analyze your data in the cloud, supporting IoT Edge as well as regular single standing devices, and then just ensuring that we have end-to-end security for your devices as they connect to the cloud. Once we kind of just get that connectivity to the cloud, we need to make sure that we keep you connected. So making sure that we're seeing telemetry flow both ways, both into the cloud as well, being able to send commands back to the devices, whether it is to update firmware or just be able to update properties on the devices. And we do all of that through dashboards and visualizations in the product that allow you to easily, through a UI, be able to manage your devices and see the data for them. We also provide rules and monitoring for your devices so that you can you can monitor the things that you care about. So for example, if you want to make sure that, if a temperature of a device goes above a certain threshold, someone can be notified, whether it's an email, SMS, or something like that. You're able to create those rules and monitoring in the product. As well as just, we have all the ACLs and user management permissions to ensure that the users that come into your product get to see what they have to see to do their jobs or see their data without having to compromise access to others' data. And then the last piece is just really about the transformation. And this is really where the value for IoT comes in, right? So once you're able to use bridge the data from IoT systems into other products or your dashboards or whatnot using the connectors and extensibility APIs that we provide, then you can realize the full value of IoT. So some of the things that we also offer in the product, essentially the industry-focused application templates, which I'll talk about next. We also provide white labeling capabilities, so you can skin the product to look and feel like your brand, to represent who you are. We are working on multi-tenancy support in the product to essentially ensure that you can onboard multiple customers into the same application. And then, as I mentioned, we have all the extensibility surface and APIs. So knowing this, a lot of the questions that we get is, okay, how did we get started? So let's talk about that next. Next slide. So with IoT Central, it's very easy to get started. You can just easily go to our portal, apps.azure.iotcentral.com, learn more about the product, and then just deploy an application. We have taken a holistic approach to be able to create industry templates and reference architecture for different industries that allow you to understand how to build your solution. But as you can see, and this might be a little bit small on the screen, but you can see it from the website directly, the centerpiece of IoT Central, the part that we take care of for you, it's still small compared to like the rest of the things that you still need to build outside of IoT Central to be able to take advantage of all of the IoT data. And that's where our partners like Cities Tech comes into play to help you build that end-to-end solution. So Farouk, I don't know if you want to comment a little bit more about kind of the value that you guys bring to help customers build something end to end?
Yes, thanks for that. Thanks for the question. So with CTS Tech, we've been in the IoT space for a while, and we've been working with Microsoft for quite some time now. So we have solutions across IoT, and in terms of the reference architectures, in terms of the tools that we build, the accelerators that can actually come out of play. And also, we do have experience in device onboarding and device connectivity. For example, there are devices which are not internet enabled by default. We start even in that level where we do embedded programming and help devices to speak to the internet to start with. Then we have the data ingestion phase, and when we have the data processing phase where we have big data processing come into play and whatnot. With IoT Central, of course, what happens now is that a lot of this journey is actually taken care by IoT Central itself. So in case where where you want to do more customizations and things like that, we have tools and accelerators which are built on top of on IoT and especially with Azure that really helps us to kind of build an end-to-end application for our clients and customers.
Awesome. Next slide.
Yes.
So we have some capabilities that we've released in the product over the past couple of months that we're excited to share with you, and also talk a little bit more about what's coming in the product next. So as I talked about previously, we've released these app templates for different industry verticals, and we spent countless hours understanding the industries, talking to customers in those industries, and building applications with customers in those industries side by side to make sure that we understand and build the capabilities that are needed to build an application for that specific industry. We also have the white labeling capabilities that we discussed earlier to making sure that this SaaS product belongs to your brand and looks like your brand. More recently, we introduced Azure IoT Edge support in IoT Central so that you can manage and deploy Edge and the modules from IoT Central directly, as well as we added support for Azure Sphere so you can connect Sphere devices seamlessly into IoT Central and manage them and keep them secure. We've also done a lot of work in the dashboard space to making sure that you can see now just going from single device tiles in the dashboards to multi-device tiles, so you can monitor your fleet of devices more easily and get the insights that help you drive your business. And we've also added API support so you can actually make queries and manage your application via programmatic interfaces. Lastly, I mentioned this earlier, we've also introduced a two-tier pricing model that allows you to essentially pick the plan that makes sense for your business and ensure that you can have a predictable pricing. So we have a 40-cent per device and a 70-cent per device, depending on the volume of messages that your devices will be sending.
Got it. That's interesting.
Next slide. As we look into the future, one of the areas that I'm excited to share some of the feature capabilities that we are working on within IoT Central. So we talked about the two-tier pricing. We're still evaluating other tier pricing models to essentially have support for low volume devices that go beyond what we support today, making sure that you're actually paying for what you use. We're also adding diagnostics in the product so that you can actually more easily troubleshoot connectivity issues with your devices, as well as kind of see the raw messages that devices are sending. We're continuing to work on the jobs infrastructure to essentially allow you to do bulk device management and making it easier for you to do that from the product by adding rerun and schedule jobs for your devices, as well as adding capability for indoor maps. So you can actually start tracking your devices within a building as they report locations like that. We're also adding support for offline commands, so you can actually send a command to a device, and then when the device wakes up, it will receive the command and execute it. And also working on auditing capabilities, so you can actually see who made changes to what device when. Today, we support data export to other systems. We are working on enhancing that to essentially add filtering and enrichment capabilities. So that's one less thing from what was alluded to earlier. It's one less piece of additional components that you have to build outside of IoT Central you'll be able to do within the product. As well as adding support for device scopes to ensure that users only have access to the devices that they need to access to be able to manage the solution without being able to see devices from other customers or other sensitive information. And lastly, I'll talk about device updates, which is one of the great capabilities that we are bringing into the product to essentially allow you through the Azure Device Updates service, being able to manage your devices and be able to just keep them up to date.
So, Louis, as I told you, the indoor maps is something which really excites me most. Of course, everything else is music for my ears, but indoor maps is something that I'm most excited because hospitals tend to be large real estate spaces,
Right. Yeah.
and devices are really mobile. So you need to keep tracking your devices where they are, and it's quite a bit of a job to do that in a hospital. So this is really good
Yeah.
stuff to have.
Yeah. Well, we're excited to be adding these capabilities. Yeah.
Sure.
Okay. I
All
think
right.
with that, I think what we're gonna do now, I think I'm gonna hand it back to Farouk, who is gonna provide a demo of something that they built on top of IoT Central to give you an
Yes.
idea of what this looks like.
Yeah. So I'll just quickly talk about what we did. So we built, so we spoke about the remote patient monitoring cases multiple times so far. So why not showcase something that we built using Azure IoT Central? Uh, so in fact, Azure IoT Central comes with a ready-made theme for us to kind of, just go and build on top of. So I'll be lying to you if I tell you that we spent a lot of time to building the demo. It actually will. So we actually what we did was all that we had to do was use an existing template from IoT Central, which is called the continuous patient monitoring. They actually have the reference architecture for you. They have a good documentation for you, and we just have to follow that. So what it basically means is that if you have devices, it could be a knee brace or a knee implant, or it could be a wearable device. You can actually use something like a mobile gateway to get all your data using BLE, your Bluetooth Low Energy, and that gateway can actually pass the data on to IoT Central, and IoT Central does the magic behind the scenes for you. And not only does it actually stores the data into LAM into its own data store like Cosmos DB, and you can build dashboards on top of it. It actually also gives you a connector which b- allows you to take the data out of from your IoMT data into Fire. Now, as you know, Fire is very important tool that is going to be critical for us in the case of data exchange and interoperability going forward. So it actually provides you out of the box Azure API for Fire. So all you have to do is that you don't have to kind of go and mess around with the database as such to get data. All you have to do is call a REST API, which is Fire enabled basically, and you get the data, and you can actually use that to either showcase it onto the or you can use machine learning to simply or your machine learning algorithm can simply use that same Fire API and get the data to running its machine learning algorithm on top of that. So it actually has cut down the chase a lot, to be very, very candid about that. So let me showcase this demo to you. All right. So Louis, what we actually did here was we actually used one of the templates that Azure IoT Central provided out of the box. We went ahead and did some customization. So what you see on the screen is basically where we get data from the devices, which is for a patient. So the patient is basically at home, and we are able to get his respiratory rate, his heart rate. All this data is actually being fed to us via the system. Of course, this is a simulated data, but all you have to do is basically hook up the right device into this. Similarly, you have body temperature coming up and showing it to you. So the one thing that we actually did a customization to the template was we wanted to see whether we can actually track the patient himself. So as we spoke about earlier, that we would like to do a patient tracker, an electronic patient tracker. So we actually kind of hooked that into the system. And so sorry to disappoint you, Louis. We took entirely 2 hours to finish the entire template today. So we could actually deploy this entire thing in just 2 hours, including the customization that I'm speaking about. So that's where that's where I was speaking about. Like this is a fantastic piece to kind of showcase
Awesome.
the prowess of what an Azure IoT actually brings to the table. This is something that organization can touch and feel and look and play with, and then perhaps take a call whether they want to get into the system or not. But this kind of bridges the gap that we have been seeing in the past, where a lot of organizations do know that they want to get into the space but are sitting on the fence, perhaps for various reasons. But thanks to Azure IoT Central, that learning curve, that complexity has been taken away. So all we have to do is just plug the system in and customize the way you want to. So as you see, this was a customization that we had to do, and I think our folks just took about 2 hours to finish this off. So that's an impressive task to have. I would like to take time to say thanks for spending, thanks to Louis as well, because I think we spent almost an hour or more than that to kind of walk you through this IoT journey. And thanks for the insights that is brought to us. And thank you to the listeners who have joined in. This is CTS Tech and Microsoft. Please do reach out to us in case you have any questions. You can reach us at the email address given below, info@ctstech.com, or you can look us up at LinkedIn. If you want to reach out to me for cloud, you can reach out to at farooq.mullah@ctstech.com, and I'll be happy to answer any questions that you may have. Thank you for your time. Thanks, Louis, once again. Bye.
Yeah, thank you. Thanks for having me. It was great
Cheers.
speaking with you.
Yeah. It's great speaking. Thanks, Louis. Bye.